Warm greetings to all of you. Today I'm going to discuss regarding the complications of shingles. Shingles, as we know, is a viral infection and it is caused by Varicella-Zoster virus. It is the reactivation of the Varicella-Zoster virus which results in shingles. And it's a infection which involves the nerves and the skin, leading to painful rashes and the blisters. It usually occurs in elderly adults more than 50 years of age, but anyone who has stress, has diabetes, has other comorbidities, is on immunosuppressants, taking certain medications for rheumatoid arthritis, patients with chronic conditions like heart, liver, kidney problems, and also cancer chemotherapy patients are at a high risk for the reactivation of the varicella zoster or shingles. So I will start off this patient who is a 40-year-old gentleman who had diabetes. It was controlled. However, he developed this redness and swelling of the left earlobe. Now, he went to the ENT surgeon who thought that probably it is bacterial infection, perichondritis, and he was started on first-generation cephalosporins. But despite 3 days of antibiotics, the patient was still having severe pain as well as swelling in the ear. Subsequently, the pain was increasing, and the wife pointed out that there's probably some discharge, pus discharge, which is also coming out. And for this, after 3 to 5 days, his appetite had gone down. He was not taking orally, and hence IV antibiotics, amoxicillin, clavulanic acid, and linezolid had to be started. Now, these are common antibiotics, or these are antibiotics which are given for the skin and soft tissue infection. With these, there is definitely a decrease in the pain, but the swelling inside or the lesion inside were persistent, and the pain was very, very excessive. And sometimes because of the excessive pain, he was also having vomiting. Subsequently, what happened is that he developed complete weakness of the left side of the face. And this is facial nerve palsy, which is infranuclear facial palsy. And he was also complaining of 50% hearing loss. He had hypertension. The BP shot up to 180 by 100, which is severe as well. And he had to be hospitalized for controlling the pain as well as the blood pressure. Now, over a period of time, definitely his hearing uh, has improved. His blood pressure is also under control, and the face has recovered completely. But look at the complications which has happened. And this can happen because shingles sometimes can present with very, very subtle signs as well, and it can be difficult to diagnose because of the characteristic of the infection per se. So, what can be the complications of shingles? How villainous shingles can be? So, in the acute phase, like when it happens, it can result in the severe pain because it's the nerve which is involved here. And in fact, my own mother, she had developed shingles, and during the acute phase, I had to give her IV tramadol, which is IV painkillers for controlling the pain for almost 5 days. Now, this is a lady who had consulted to us for the severe pain, and as you can see, she is crying in pain. The other complication which can happen is the secondary bacterial infections. So this is a lady who had consulted to us from Hyderabad, and she had developed secondary infection of the shingles lesions. This is another lady from Noida who had consulted to us from telemedicine, and she had developed this severe shingles on the face, and this was out of stress. So this is a young lady who had lost her mother-in-law, and then subsequently she developed this severe shingles. Now this did not involve her eyes, but if it involves the eyes, then it can result in vision loss as well. This is another patient who had lesion on the nose. The nose lesion is not very prominent, but he had severe ulcerations inside the mouth, and because of this, he was not able to eat for almost 15 days. So shingles, depending upon which part of the body is involved, can result in complications. Shingles can result in brain involvement as well. So it can result in meningoencephalitis, and the patient can present with headache, vomiting, can get admitted, and may also need a lumbar puncture for the diagnosis of the etiology. And sometimes it can have spinal cord involvement as well. Other organs like pancreatitis or liver involvement can also happen. These are not common, but these are the complications which one has to just kept in mind. The most common complication is post-herpetic neuralgia, and it can happen to 15% of the elderly patients. This post-herpetic neuralgia is that the pain is persistent beyond 3 months, and it can happen even for several years. I've recently had a patient who's come after 2 years, and he says that whenever I wear a cloth, I have this burning sensation in my chest wall. Now, shingles not just results in complications in the person who has got the disease or the infection, but it can also result in infection to others. See, if it is only involving a particular dermatome, then it is not really contagious. But if the lesion is very extensive, and if suppose the caretakers are not, they've not had chickenpox in the past, then they are susceptible. This is the young adult, the son of the lady who was crying I previously showed. He had not had chickenpox, but then subsequently he developed chickenpox, which was very extensive, as varicella or chickenpox in the adults can have extensive lesions. So shingles it's a myth that shingles is not serious. Shingles definitely can lead to severe and long-term complications. So this historical quote is very relevant to the idea of prevention, that prevention is better than cure. And often it is asked that, how expensive is the vaccine? So this is again very important to remember that an ounce of prevention is worth a pound of cure. And this is my dad who has received the shingles vaccination. So the idea of this presentation is to create awareness regarding the infection, that there are certain infections. This is how shingles can present. It can present with pain initially, and then the rashes can develop. Early diagnosis, if it happens, then treatment can be initiated early so that we can prevent the complications. And of course, if if we can have solutions for prevention, why not use them in clinical practice? So let's create more awareness and let's prevent infections. Thank you so much.